It's M123 FM in the Newberry News as we catch up with what's happening at Helen Newberry Joy Hospital. Danae is with us. Danae, how are things going?
Great.
Tell us what the latest is with Helen Newberry Joy Hospital.
We have quite a few things going on right now. We have the influenza shots are going to be coming pretty soon. We're not sure the date yet.
Okay.
But if people go to the website and the Facebook page, they will see when we announce that they came.
Okay.
We have bicycle helmets that we are giving away to children who come in for a well child visit. And so when they come in for a well child visit, we just ask, do you need a bike helmet? And we give out whatever size they need, which we've enjoyed doing that. The Curtis Clinic is on the way to being built by February, we believe the end of February. So we're excited about that. We're modernizing and bringing in new equipment and things like that. And then we have this amazing award that we're excited to announce and to share that Dr. Beaulieu is going to give us more details on.
Exciting times at Helen Newberry Joy Hospital. Once again, you can check out the Facebook page, or as always, follow them online at hnjh.org. Dr. Beaulieu is going to come up, tell us all about the exciting news of the brand new award and program coming to Helen Newberry Joy Hospital. Back with Dr. Michael Beaulieu, Helen Newberry Joy Hospital and Healthcare Center, here to tell us about an exciting award and program. Doc, tell us all about the H Systems program.
Yes, we've been recently recognized as committed to care excellence by the Age-Friendly Health Systems program. The Age-Friendly Health Systems program is a program that's was started by the Institute for Healthcare Improvement, and here in Michigan, it's sponsored by the Michigan Hospital Association. Helen Newberry Joy was approached a couple of years ago about participating in this program because it was fairly new at the time, and they know that we like to be on the front edge of what's new in healthcare and the latest improvements. The Age-Friendly program is based on the principle of the 4 M's, which I'll talk about shortly, but it applies to our aging population. The population of 65 and older is the fastest growing demographic in the country, and historically, for obvious reasons, they've been big utilizers of healthcare just due to the changes of aging. When I found out that Michigan is projected to be the first state where the over 65 population will outnumber under 18, I knew we had to be ready for that and be part of this program.
What are some of the big advantages that this program can bring to the community?
It's a way of helping tailor our care to the elderly. Instead of one-size-fits-all health care, everybody who comes into the clinic, we look at tested principles that work best at helping the older adults achieve their goals. The big difference between this and some of the other programs, because a lot of our patients are familiar with our checklists. When you come in, you got to get your colonoscopy, you got to get your blood test. This program also takes a pause from some of that and has the conversation, what matters to you, the patient? And we find out what their goals are, and then we help tailor those goals and tailor our treatment program to what those goals are. Common example is end-of-life care. Everybody might have different goals there. One adult may tell us, I want to stay alive and alert and be able to talk with my family as much as possible, even if it means I'm suffering while I do it. Another may say, pain management is important to me, and I understand that sometimes medications might make it more difficult for me to interact with my family, but I'm okay with that as long as my pain is under reasonable control. So that's what the program is mostly about. We look at medications and the effect that they have on activity and well-being. We also look at mentation. We focus on trying to screen for, identify, and treat dementia, depression, and other things that can affect the older adult. Mobility. How do we keep somebody moving to accomplish their goals? And a lot of what we're doing in this program, we found out when we started, are things we've been doing for quite some time, but we've learned some new things too that we can add to that. So we're pretty excited about it. There's two levels of participation
Okay.
at this point. The first is when you say, hey, we want to be part of this program, you come up with an action plan, and then you're designated as a participant in the program. After several months of putting these principles into practice and submitting the data, you achieve the designation Committed to Care Excellence. And that's what has happened recently at the Gibson Clinic at Helen Newberry Joyce. They've been recognized as Committed to Care Excellence. And I like to remind everybody that while it's a great recognition, it's not the end of the road. It's just the beginning of the program. We'll continue to get education on treating our elderly. Next week, some of us in the program are going to be attending a seminar on how to take everything that we're doing so far and make it sustainable. So it's something we're still doing a year from now, 2 years from now, 5 years from now, and even better at that time.
What other information should the public know about the program, and what are the different ways they can start to get involved?
I think the most important thing that our older adults can do is when they know they're going to be coming in to see their doctor, think about the things that matter to them and communicate that to your healthcare provider. Many of our providers are excellent at doing that already. That's a big focus on a lot of the visits already is, okay, what are your goals for being here? Not just what's the clinic goals, what's the doctor's goals, but the patient, what are your goals for being here? And so as much as anybody who comes to our clinic can be thinking about that and be ready to share that with us so that we can help them reach those goals, that would be fantastic.
All right. Of course, as always, if you want more information, you can contact Helen Newberry Joy Hospital, follow them on Facebook, or check out the website. It has everything you need to know at hnjh.org. With Helen Newberry Joy Hospital and Healthcare Center, I'm Dan Hardbrook. This is M123 FM in the Newberry News.